Welcome to the new channel. Here we're going to discuss the rapid recalls, which is highly based on MCQ on clinical based approach. Definitely not going to be the in-depth lectures, but still we cover the high-end topics here. Let's start with the esophagus. Esophagus is a small topic, but highly tested in the exams like NEET PG, FMGE, especially through the clinical scenarios and image-based questions. Esophagus starts with the upper esophageal sphincter, which prevents the air entry, and up to the lower esophageal sphincter, which prevents the acid entry going up. Let's start with the basic anatomy. This is extend up to the from incisor, upper incisor teeth till the diaphragm, which is up to 25 cm in length. Extend from C6 to T11. There are three natural constrictions, which is cricopharynx, a trachea, a left bronchus, and the diaphragm. A cricopharynx is 15 cm in male and 14 cm in female, and the trachea up to 26 in male, 24 in female, and the diaphragm will be 40 in male and 38 in female. The narrow spot, which is cricopharynx, 1.5 cm approx. Anything passing cricopharynx usually passes through, except the sharp objects or button batteries. So remember this clinically. There is some important characteristic features to remember. That is no serosa, which is the exam favorite, asked most number of times. Esophagus is lack of serosa, and there is no villi, no secretions, and no main snug plexus. Damn, bro. Damn. Wow. Let's look into some clinical approach. Foreign body. Foreign body in trachea versus esophagus. It is highly tested topic, especially clinical image-based questions. Coin in trachea. You can see the edge seen in PA view and the flat surface in lateral view, and flat surface in PA view and edge in the lateral view, which is represent the coin in esophagus. If the patient is having the difficulty in breathing, the foreign object is in trachea. If the patient is difficulty of swallowing, you think about the esophagus. Let's move on. Another important topic, which is congenital diaphragmatic hernia. Herniation of the bowel loops into the chest cavity or thoracic cavity through a defect in the diaphragm. There are two major types of congenital diaphragmatic hernia. The one in the right anterior median, which is Morgagni hernia, and left posterior lateral, which is Bochdalek hernia. Let's look one by one. Bochdalek hernia, the herniated bowel, which compresses the lungs, which cause the respiratory distress, cyanosis, and then scaphoid abdomen, which leads to reduced breath sound. The abdominal organ herniated into the chest, which is a common thing in the congenital diaphragmatic hernia. When you look up to the chest X-ray, you can see the mediastinal shift and the bowel loops in the chest. We can see the abdominal organs in the thoracic cavity in ultrasound and CT imaging. The content here is small intestine. This is going to be the content, which herniation. The management will be stabilize the patient and respiratory support and surgical repair. Let's move on to the Morgagni hernia. Morgagni hernia is the right anteromedian, and which is quite less common, and that would cause the respiratory distress since it compresses the lungs and cause the sinuses and reduce the breath round as well as. You can see the chest X-ray in mediastinal shift and the bowel loops in the chest and abdominal organs in the thoracic cavity. Here, the content will be transverse colon. Transverse colon will be the content in Morgagni hernia. The major between these two hernia, which will be the location of the defect in diaphragm and the content. The most important cause of death. Here, the pulmonary hypoplasia, which causes pulmonary hypertension. Here, the underdeveloped small lungs have the reduced vascular bed, which increases the resistance to blood flow which cause the pulmonary hypertension. Share the wardrobe tips. If you see the newborn with respiratory distress associated with scaphoid abdomen, you think about the Bochdalek hernia. With slam, gastroesophageal reflex disease. It is mainly due to when the lower esophageal sphincter remains opened, then the acid reflex is going above. See the trade, which is retrosternal heartburn and epigastric pain associated with food regurgitation. How do we diagnose the GERD, which is 24 hours of pH monitoring, which is the investigation of joint, not endoscopy, not ultrasound or any other imaging. And the treatment will be proton pump inhibitors. The surgery will be nasal fundoplication, which is a gold standard surgery for GERD. Now, what is the complications? When the GERD persists for a long time, it leads to Barrett esophagus. Barrett esophagus, which is a type of adenocarcinoma, where squamous epithelium transforms into intestinal epithelium, which is asked many times in the exams. When the chronic reflex, think Barrett esophagus, which is high risk in cancer, basically adenocarcinoma. Let's move to very important topic, which is Zenker diverticulum, which is also known as false diverticulum. Yes, it's not untrue. It's a false diverticulum. This is mostly seen in elder people. Look at this image. You can see the weak throat muscle, which forms the false diverticulum like a pouch. The major symptoms are dysphagia, which is most common, and fluid creation and halitosis, and the complications with aspiration due to pneumonia and lung abscess, which is highly risky in squamous cell carcinoma. And the investigation of choice will be barium swallow. You can see the both here. Let's move on to the treatment. The treatment usually the cricopharyngeal myomyotomy and diverticulopsy. If you see the elder patient with regurgitation and having that bad breath, which is halitosis, you can think about Zenker's diverticulum. Got some MCQ traps and tricks. nocidosa, which is most commonly asked MCQ-based traps. If you see the nocidosa, you think about the esophagus. And then the kind orientation. If you see the HS in the PA view, think about it's in trachea. If you see that H in lateral view, think about esophagus. And in diagnosis of GERD, which is not endoscopy, 24 hours of pH monitoring. And Zenker diverticulum is also known as false diverticulum.